now. Awesome. Well, hi, everyone. My name is Heather Williams. I'm the Director of Policy and Outreach with the California After School Network, and excited to have you all joining us this afternoon. We are very excited to be co-hosting today's event with our friends at Vaccinate All 58, and with some special guests from the California Department of Public Health. And so today we're talking about COVID-19, and specifically we will be talking about vaccinations, the latest on the vaccination requirements, hopefully what will be helpful for you all as you're planning to go back to school, or if you've already headed back to school. I do want to note we aren't going to be talking about testing requirements or masking requirements. This is specifically focused on vaccination. So if you have those questions, please hold those for another time. But if you do have questions as we're going through and chatting about the vaccination requirements or just the information that's being shared, please feel free to drop those questions into the chat box as we're going along. We'll also have plenty of time and resources at the end to chat more. So with that, want to thank I want to thank my CAN team members who are here and supporting. So thanks, Melissa and Nat. And then also Carrie, who's representing Vaccinate All 58 today. And Carrie's been a wonderful partner that we've been working with for quite a few months now. And then also a huge welcome to our two doctors that will be joining us shortly to talk about all the details. So with that, we'll go to the next slide. So just quickly, our agenda, there will be a super high level overview of the general CDC prevention and guidance, then digging in a little bit to California's context, COVID-19 and vaccines, talking about vaccine eligibility and updated schedules. I know those seem to be changing regularly, so sharing the latest on that. Then having some time for questions and answers, as we've noted, and we've got a communications toolkit and lots of resources at the end that we will share. And of course, as noted, we are recording this, so it will be available along with all the resources and the slide deck afterwards. And so then we'll wrap up. And so with that, I think one more slide. So just a few facts to know before we start digging into the details. Last year, there were almost 6 million K-12 students enrolled in school. We know we've got students not only in the classroom, but obviously participating in expanded learning and out of school time activities and programs. And also, as a lot of us are going back to school and in classrooms and engaged in person and out of school time, we are also recognizing that COVID is here to stay, and that is impacting our classroom and expanded learning time. And, gathering together increases risk for COVID exposure and transmission. So today we are focusing specifically on vaccines around COVID-19. And so with that, again, a huge thanks to our partner VA58, and then excited to turn it over to Carrie Rose. So Carrie, turning it over to you.
Thank you so much, Heather. Really appreciate the partnership and really glad to have this conversation, as I know folks on the line are those working directly with students and families. So as back to school happens, there's definitely going to be lots of questions that come up. So our goal today really is to share some high-level information, just generally speaking, on COVID-19 and back to school, but then to really dig in with our guests, the physicians that we are lucky enough to have from California Department of Public Health, to be able to really get into the details on the vaccines. But in general, just folks may have heard that just last week, the CDC did update guidelines on back to school. So generally speaking, that the best thing you can do for prevention, obviously, is to stay up to date on vaccinations, which is part of why we're going to talk about that so much today. Stay home when you're sick, optimize ventilation at the school, and of course, all of the things we learned about hand hygiene and respiratory etiquette and cleaning. If you are interested in the details of CDC guidance, there is a hyperlink here that will be part of the presentation that's available to everyone. But just a reminder that there's no one specific set of routine guidelines that we can give everyone should numbers increase, because these CDC guidelines and recommendations are not intended to, overrule or replace local jurisdiction and decisions that are made around it depending on numbers. But generally speaking, when numbers increase, folks will have to consider strategies like masking and testing, management of the cases, and responding to the outbreak. And of course, high-risk activities will always be something to be looking at when numbers increase. So again, check out that CDC guidance if you have more questions with that link, but we can go ahead on to the next slide. Big picture in California when it comes to COVID-19 and vaccines, that there have been 79,191,867 total vaccines given. And that's an important number. Every shot matters. We're still doing daily doses of over 28,000. So you can see that it's still very much a work in process. In terms of the number of cases that have been in California, there's 10,104,761 confirmed cases. And we're still looking at a daily average of about 12,265. So it's still very much with us. The good news is that vaccination rates are really, really strong in places particularly, but we've got a 79.9% vaccination rate, and that's for children 5 and older with at least 1 dose. But again, because we're still in this, just a reminder that we have in fact lost 93,378 Californians to COVID-19, and there's still an average of 34 deaths per day. All of this information is available on the vaccine dashboard, but just wanted to remind all of us what those numbers and that data really are when it comes to COVID-19. So on to the next slide. What we want to talk about, though, with COVID-19 vaccines for COVID-19 is that they are safe and effective. We have lots of studies that continue to show that COVID-19 vaccine reactions are mild to moderate. And you've probably heard those before or experienced them yourselves with some pain at the injection site and fatigue. Vaccines lower the risk of severe disease, hospitalizations, and death. And this I think is important because it comes up a lot in conversations, that getting a COVID-19 vaccination is a safer and more dependable way to build immunity for COVID-19 rather than getting sick with COVID-19. This data can all be found on the hyperlink that you'll see at the bottom of this and the next slide. And that data is available for you to do a search anytime. And there are lots of ways to break down that data that you can see by geography, by race, by age. So if you'd like to know more about that data, please feel free to visit that site. But let's go on to the next slide. What we also know about COVID-19 vaccines is that in addition to the vaccines themselves being safe, there are still very much risks for unvaccinated and very vulnerable populations. So just a couple of examples of those facts. Unvaccinated people are 6.9 times more likely to get COVID-19 than boosted individuals. Unvaccinated folks are also 11.2 times more likely to die than boosted individuals. And vulnerable populations, and that can include things from age to disabilities and other kinds of vulnerability, they're going to be disproportionately impacted. So all of these are important reasons why we still need to be talking about COVID-19 and vaccines. And again, the data is available to anyone who wants it on the hyperlink. But as we think about those big pictures, we now want to really get specific and talk about what is the state of things around COVID-19 and the vaccines. And obviously, we need the expertise of physicians, and are lucky enough to have two today from the California Department of Public Health. So I'm going to turn it over now to Dr. Saxena, who's going to start us off with the formal presentation. And I know she'll be joined by Dr. Chen along the way.
Hi, thank you so much, Carrie. So I will be focusing primarily on COVID-19 vaccination in children, so up to 18 years of age. And we just wanted to first of all start off by stating that COVID-19 is in fact a serious childhood illness. Often people will just associate it as being, a common cold, which in some children it can be. However, in other children, it can cause serious disease. In the United States, COVID-19 has actually resulted in over 14 million illnesses in children, with almost 3 million in kids that are younger than 4 years of age, and over 144,000 hospitalizations and 1,700 deaths. And children that are the most vulnerable, those under 5, were actually hospitalized 5 times more during the Omicron phase than they were during Delta. And we've also seen that, as I mentioned, even healthy children can end up with severe symptoms and outcomes of COVID-19. 6 out of 10 kids that were under 5 that were in the hospital did not have any other underlying health problems that would have made them even more susceptible to COVID-19. Next slide. And this is, again, just kind of summarizing that COVID-19 has become a leading cause of death in children. And you can see it's broken down by the different age groups here. However, for all of the age groups, it is ranked as the 4th or 5th leading cause of death for children of all ages. And it was ranked as the #1 cause of death by infectious or respiratory diseases. Next slide. And wanted to touch briefly on long COVID. I'm sure many of you have heard about long COVID affecting adults, and we wanted to emphasize that long COVID can happen in children as well, even if they have just a mild COVID-19 infection. And the most common symptoms that you would see in children with long COVID includes fatigue, headache, trouble sleeping and concentrating, muscle and joint pains, as well as cough. And really it can affect many different body systems and overall health of these kids that get infected with COVID-19. And it can also impact their quality of life, put limitations on physical activity, or as kids are now starting to go back to school, affect their ability to participate in sports. They can have, distress about the symptoms that they're having, as well as mental health challenges. And then again, decreased school attendance and participation, which we know can also impact their overall well-being. Next slide. And this is another complication that can occur in children that do get infected with COVID-19, MISC. So this stands for multi-system inflammatory syndrome in children. And it is a rare condition. However, in children that get this, they can be very seriously impacted. And essentially, they will have different parts of the body that become inflamed. And like I mentioned, if they do get this, it is quite serious. They're hospitalized and they can become quite sick. And this syndrome has occurred in 1 out of almost 3,000 to 4,000 children that get COVID-19 infection. And again, most of those kids did not have any other underlying medical conditions. So just to emphasize, as Carrie mentioned, the best way to protect against MISC, long COVID, and other COVID-19 complications in children is to protect them against getting COVID-19 infection in the first place, which includes getting vaccinated. Next slide. So this is just a graphic that was published by the CDC and in a report looking at the multi-system inflammatory syndrome, specifically in teenagers that were 12 to 18 years of age last year. So they reported that the vaccination reduced the likelihood that children would get this syndrome by 91%, which is very very great to know that how well the vaccines are doing in protecting against these serious outcomes. And of those adolescents that were hospitalized with this syndrome, 95% of them had been unvaccinated. And none of the children that required life support were vaccinated. So really just emphasizing the importance of the vaccines that we have, of getting the youngest members of this age, of this population vaccinated to help protect them from these severe outcomes. Next slide. And we know that COVID-19 vaccines are safe. Over 200 million people, including over 29 million kids, have safely received the COVID-19 vaccine. And both Pfizer and Moderna's results showed that vaccines work very well in young children, just as they have been working well in adults. And they are very safe. Most children, as Carrie mentioned, in adults as well, only had mild to moderate side effects, such as pain at the injection site. And typically those side effects last for a short time and the kids recover from that. Next slide. And this is a overview of the COVID-19 vaccine availability and timing. Just a nice graphic that has a summary of all of the vaccines that are currently available. It is broken down by age group as well as vaccine type. So as you can see on the first graphic, it goes up to 11 years. And then on the next page, we have 12 and older. So I did want to mention at this time, only Pfizer and Moderna are authorized for use in children. And that is from 6 months of age and older. The Johnson & Johnson and Novavax vaccines are not authorized for individuals that are younger than 18. And you can see that for some of the specific vaccines, such as the Pfizer, the kids who received their 2 doses are eligible for a booster, and no booster at this time is needed for those who received Moderna. So that is just a kind of a nice summary graphic to have in case you guys are getting questions about the age groups and the eligibility and which vaccines that the children can get. And we have provided links for all of these. And this resource actually is available in both English and Spanish. So that can be accessed by the links that are provided here. Next slide. And another big question that we have seen that comes up quite often is whether or not children can receive their COVID-19 vaccine while they're getting their other routine immunizations. And the answer to that is yes, they definitely can receive the COVID-19 vaccines at the same time as their other vaccines. And we want to ensure that children are not getting behind on any other routine immunizations that they are due for or that they are required to have for school. And it is safe to go ahead and get the COVID-19 as well as the flu vaccine at the same time. Next slide. So now just want to shift a little bit into discussing the COVID-19 vaccination trends for our children and adolescents and youths. So this graphic is just a representation broken down by different ages. You can see the very bottom line in pink is those kids that are under 5. And the bottom line just represents the time going up until August of 2022. And the up and down you can see is the percent of coverage in terms of vaccination. And as I mentioned, the bottom line is those under 5, and just about 1% of that age group has been vaccinated so far. So still a lot of work to do in ensuring that these young children are getting protected against COVID-19. And then the next line above that, the blue is our 5 to 11-year-olds, and then the red is, or the red-orange is 12 to 17. And overall, as you can see, those 3 are the lowest rates of vaccination. So children and teens really have not received as much vaccination, as the adults. And that is understandable since those vaccines have come out later, but just emphasizing that there is still a lot of room to go to ensure that these kids are staying up to date on vaccines. And just want to review. So the 5 to 11, about 36% have been vaccinated, and 12 to 17 age group, about 67%. Next slide. And this is looking at vaccination trends by communities. We have noticed some differences in vaccination coverage. So in this graphic, this is looking at 5 to 11-year-olds, and we can see that those kids that are living in the most healthy conditions, represented by the green bar graph, about 54% have received their vaccine, as compared to the blue, which is 23%, and those are children living in the least healthy conditions. So quite a big coverage gap there. And again, this inequity kind of just represents the work that still needs to be done, especially for those children that are living in these vulnerable communities and environments. Next slide. So this is just a summary slide of why we should be immunizing our children against COVID-19. And as we mentioned, COVID-19 can sometimes be very severe in children, leading to hospitalizations and deaths. It can lead to long COVID, as well as a multi-system inflammatory syndrome, or MIS-C, that you all may have heard about in the news or in other articles. And it can cause these symptoms in kids, and we have seen these kids that are hospitalized become quite sick. And we know that COVID-19 vaccines provide strong protection against severe disease over time, and they have been monitored very closely and are safe for all ages, including children down to 6 months of age. Next slide. So now we just wanted to list some resources. There are some infographics that can be found at the sites listed below, but going over again, long COVID, and then risk comparisons for teens and youth as well of COVID-19. Next slide. And then again, we've broken down additional resources that can be used for staff that are serving infants, children, and teenagers that are on this page. And these are a lot of great toolkits. We've got social media toolkits that can help promote the benefits of vaccination, and they can be found typically in English and Spanish, and then some of them might be in other languages as well. We have the CDPH Let's Get to Immunity Toolkit that has some great informational videos, and these are all linked here for access for further use. And then next slide. And then this is just the resources that we've broken down that can be provided for parents or guardians, as well as for children and teens, to give them more information and help them feel empowered to have that information about COVID and vaccines at their hands. So I think that is the last slide for me. We would like to thank you guys for your attention, and if you have any further questions, Dr. Chen and I are on the line, and we would be happy to help answer. Thank you.
Wonderful, thank you. That was very informative, and so far we have not seen anything question-wise come into the chat box, but I am seeing perfect a hand raised. So Sarah, feel free to come off mute and ask your question.
It's about the new CDC guidelines. I just want to make sure that I understood correctly. Before you needed to test out after day 5 to leave isolation. Now, as long as symptoms have improved and you wear a mask for 10 days, then you don't need to test negative to end isolation after day 5.
Carrie, I'm not sure if you can ask that. I know up front we did flag we would probably only be able to answer questions around vaccinations and not necessarily around the testing or masking requirements.
Yes. So Sarah, thank you so much. It's such a good question. And I know it's just such a confusing time at the school site level, right? With all of the changes that may or may not exist. But I think in general, you can find that answer on the CDC guidelines, knowing that depending on local communities and conditions, it may change. So we can't answer it only because, as far as my understanding is, that it's guided, the masking decisions are guided depending on local conditions. And I don't know, Dr. Chen or Dr. Saxena, if you want to add anything in on that.
This is Dr. Chen. We're a little bit more well-versed on the vaccine subject. Have not been keeping up with, admittedly not keeping up with the other guidelines. This is, we're experts from the immunization branch. So I'm sorry, I won't be able to answer that except to refer you to the CDC guidance.
All right. Anybody else, if you have any vaccination related questions, please do feel free to add those to the chat box and or put your hand up, and happy to answer those. But right now I'm not seeing anything. While folks are thinking about if they have any questions, I do just want to flag, we know a lot of folks within the expanded learning world are staff that are working directly with their kids and families. You all are often the most trusted messengers, and it is likely that there are questions from both, students and also their families that might be directed to you all. So we were hoping this can give you a lot of the information specifically around vaccinations to equip you as you are having those conversations. And if there is a lot of interest in other conversations around masking and testing, we can look to see if we can find folks to partner with to send out more of that information. But really today we wanted to make sure we were getting out the information on vaccinations. And yes, more resources being added to the chat box. Still not seeing anything pop up question wise. So Carrie, might be a good time to turn it back over to you to chat a little bit about the next slide and our back to school toolkit.
Sure, and curious for folks too on the call, if any of those numbers that were presented surprised you. Particularly the numbers around the vaccination rates for both younger children, but also teenagers, and if that's representative of your local experience. The reason I'm wondering that is not only because we have experts on the line who could address questions and concerns about why there might be some hesitancy, but also because I think, as back to school comes up, we're wanting to think about all the ways in which the Vaccinate All 58 campaign is wanting to think about all the ways in which we can provide access to vaccinations if people need it, resources around information if people have questions about whether it's something they want to do. But then also just, generally speaking, we want to make sure it's an equitable distribution of resources throughout the state. And I know that some places it's easier to access some of those resources than for others. So one way we as Vaccinate All 58 went about that is to create a social media toolkit so that anyone can access information to share bits and pieces, including some of that background information about how could you go about getting testing information? How can you go about maybe setting up a mobile clinic? How can you get fact sheets about what is or isn't true? Because there's lots of stuff going on there in conversation around vaccines. So we have lots of resources. You can find them online with the toolkit link that we've got here. And again, this will be available to everyone as part of your participation. We'll be able to share the PowerPoint slides. So we'll have this and certainly want to share it, but want to just take a breath now, since I did pose the question to participants about, did any of that information surprise you? You can either unmute and say so or put it in the chat. Sure, Julie, thank you. Mhm. Particularly if you have questions about whether those numbers hold up in your community. Yeah. Okay, so maybe they didn't surprise you, maybe you knew. Obviously, we are concerned about some of those lower numbers and want to support and encourage anyone who's interested in getting resources into communities to be able to increase them. So the back to school toolkit is one way to go about that. You can also reach out to Vaccinate All 58. So if you want to go forward to the next slide, the Vaccinate All 58 campaign can answer questions that you have. For example, some of the pieces that came up today. There's also a link where you can book a vaccine appointment for yourself, for your families, for loved ones, or you can direct folks there if they need to do that. And I know we talked a lot about resources being available in English and Spanish, but the Vaccinate All 58 campaign has many, many resources available in multiple languages. I think generally speaking, we have up to 14 languages represented and are looking at ways to increase partnerships to be able to expand that number. So that is what we had on behalf of all Vaccinate All 58. One last turn to Heather around any last thoughts or final details you have. Special thanks to Dr. Chen and Dr. Saxena for helping share this information. As you know, it's recorded and we're going to be sharing this far and wide within the CAN network as well as Vaccinate All 58. So thank you.
Great. Well, thank you so much, Carrie. Appreciate you and the Vaccinate All 58 team and working with you. And much appreciation to our two doctors for coming and sharing their expertise. And, you know, I appreciate that there's questions around testing and masking and, you know, apologies that we're not able to get into all the weeds on those questions, because I know that that's a whole other set of questions that folks are interested in. But hopefully we were able to get some of your questions around vaccinations answered. And so, yes, as Carrie said, we'll be sending out this recording with the slide deck, so you have access to all the links, all the resources. We'll be posting this on our website, so you can direct folks to that if you want to share with other folks. But just appreciation to everyone for joining. And with that, I'm actually going to turn off the recording